Bye. Thanks. Bye. Okay.
So hurdle step. Position the string so there's the level of the tibial tuberosity. Record this length for the ILL test.
Sixteen.
Place the dowel across the shoulders. Stand with your feet together and your toes touching the hurdle. Keep an upright posture and step over the hurdle without touching the string. Touch the floor with your heel and return to the starting position. Left and right foot each have 3 trials. Score the leg that is moving over the hurdle.
Hi, Dr. Marth.
Next is the inline lunge. Place the back right foot toe on the 0. Place the heel of the other left front foot on the distance of the tibia. Use the measurement taken in the high step for the tibia length. If the left foot is forward, the right arm is up and left arm is down. Put the right hand on the dowel in the cervical lordosis and the left hand on the dowel and the lumbar lordosis. Maintain contact with the dowel on the posterior head, thoracic spine, and sacrum throughout the test. Descend into a lunge position. Touch the right knee behind the left heel. Keep the dowel straight up and down. Return back to upright and score the front leg. Impingement clearing test. Place the right hand on the left shoulder. Keep the hand placed on the shoulder and lift the elbow up to the forehead. Ask if this is painful.
Is it painful?
If it is painful, score is positive, and then that arm SM test will be, shoulder mobility test will be a 0. Is that painful? Next is the shoulder mobility test. Measure the distance between the distal wrist crease to the tip of the 3rd finger.
Third finger. That'd be 8.5.
Have the patient stand with feet shoulder width apart. Place the thumbs in the fists. Move one upper extremity into internal rotation and the other into external rotation. Make sure there is a smooth motion, no creeping the arms into place. The tester measures the distance between the 2 hands, the 2 closest bony prominences.
Maybe 11.5.
Make a fist with the thumbs tucked in the fist. In a single motion, place your right fist over your head onto your back and your left fist behind your back, attempting to touch the fists. Do not move your hands closer after initial placement. Test the opposite arm. The arm is up is the testing arm on the recording sheet.
8.5.
Next is our active straight legs. Active straight leg raise. Lie supine with arms in an anatomical position, palms up. Let's get it over here. Okay. With the head flat on the floor, the board is placed under the knees. Just want to place this board underneath the knees. ID the midpoint between the ASIS and the mid-patella. Place the dowel at this point perpendicular to the ground. Instruct the athlete to lift the test leg with a DF ankle? Dorsiflexed ankle and extended knee. The opposite knee must remain in contact with the board. The dorsiflexed ankle must stay up toward the ceiling. No external rotation of the hip, and the head must stay flat on the ground. Once the end rate of motion is achieved, the lateral malleolus is located. Okay. Bring it up. All right. End range of motion is achieved. Okay. Malleolus is located. If the malleolus passes the dowel, the score is a 3. Does not pass. If the malleolus cannot pass the dowel, then realign the dowel. Place the dowel between the mid-thigh and mid-patella. If the malleolus passes the dowel, the score is a 2. If the malleolus cannot pass the dowel, then realign the dowel. Place the dowel between the mid-thigh and mid-patella, and malleolus passes the dowel, the score is a 2. Okay, sorry, just redid that. If the malleolus cannot pass the dowel placed at the mid-patella, the score of a 1 is given. Sorry about that. Press up clearing test. Prone position. Have the athlete place both hands under the shoulders, palms down. Press the chest off the floor by extending the elbows and arching the back as much as possible with keeping hips on the floor. Ask if this has any pain.
Is there any pain?
If yes, score is positive. And score the TSPU as a 0. Trunk stability push-up test, which is next. Trunk stability push-up test. Prone with feet together, toes on the ground, arms start overhead. Bring thumbs down to the forehead. If female, the thumbs would come down to the chin. Barry's a male. Knees are fully extended, ankles dorsiflexed. Ask the athlete to perform 1 push-up. The body should be lifted as a unit. There should be no lag in the lumbar spine. If the athlete cannot perform this correctly, then the males would move the hands down to the chin and the females would move the hands down to the clavicle. Then you would make sure the original hand position is maintained, and then hands do not slide down when the athletes prepare to lift. Make sure the chest and stomach come off the floor at the same instance. Give the verbal cue to maintain a rigid torso. Raise yourself as 1 unit with no lag in the low back up into a push-up position. Next is the posterior rocking clearance test. Start in the hands and knee position. Have the athlete keep both hands on the floor and rock the buttocks back to the heels. Lower the chest to the knees and reach the arms out in front of the floor. Ask if there is pain.
Is there pain?
With this clearing test. No pain. If there is pain, the score test is positive, and score the rotary stability test 0. Next is the rotary stability test. Start in a quadruped position with the shoulders and hips at 90 degrees relative to the torso. You're going to use this. Okay, never mind. The knees are at 90 degrees flexion and the ankles are dorsiflexed. Put the board between the knees and hands so they contact the board. Shoulder flexion and hip extension on one side. Raise up 6 inches off the board. The elbow, hand, and knee should all remain in line with the board. The torso should also remain in the same plane as the board. The same shoulders extended and knee is flexed so the elbow and knee never touch the board. The shoulder is flexed and the hip is extended and then placed back to the starting position. If this cannot be completed, move to the diagonal position and retest. Score the uneven side.